Welcome to Susan G. Komen New Jersey's fourth webinar featuring Dr. Sharyn Lewin. My name is Michelle Cash. I'm the Director of Mission Events and Operations for Komen New Jersey. Today we'll be talking about genetic testing, how to decide if testing is right for you, and what you should know before you talk to your doctor. One of the missions of the Susan G. Komen Breast Cancer Foundation is to educate and connect patients with experts to answer their questions. Our speaker today, Dr. Sharyn Lewin, brings more than 20 years of medical, research, and community outreach experience to her role as Executive Director of the Lewin Fund to Fight Women's Cancers. She serves as Medical Director of the New Jersey-based Holy Name Medical Center's Gynecologic Oncology Division and is an Assistant Clinical Professor of Obstetrics and Gynecology in the Icahn School of Medicine at Mount Sinai Hospital in New York. She is a national authority on hereditary genetics. With over 100 publications and extensive educational involvement in the importance of genetic testing, Dr. Lewin has lectured to advocacy groups, patients, providers, and physician organizations on both a national and local level. She's passionate about eradicating hereditary cancers and improving the quality of life for those affected by cancer. Thank you for joining us today, Dr. Lewin.
Thank you so much.
I guess the first question to ask is a pretty basic one. What is genetic testing, and who should I be asking if it's right for me?
That's a great question. So genetic testing is either a blood test, or it can either be sampling some saliva from the inside of the cheek, a buccal swab, which looks for different genes that could potentially be defective. So we all inherit genes from our parents, half from our mom's side and half from our dad's side. And now, if we really want to make a difference in the war against cancer, trying to understand our family history, our personal history, and what risk factors put us at risk for potentially different hereditary cancers, we can now undergo genetic testing to really help mitigate or decrease that risk. So essentially, it really is just identifying your DNA, either through a blood test or through the buccal swab.
Well, why should I talk to my doctor about genetic testing? What could I learn that would be helpful to me or my family? And on the other hand, what are the possible downsides?
So the criteria for genetic testing has constantly changed. So for example, people who maybe did not meet criteria in the past for genetic testing might meet criteria now. And so that's why this is important to always have an evolving discussion with your clinicians. We know that there are certain hereditary cancers that certainly can be prevented if we identify these high-risk mutations and then have people either participate in more surveillance or screening, or even undergo prophylactic surgery, just depending on which mutation we find can dramatically alter their risk of developing cancer.
So why would I not want to do this, potentially?
So there's really no downside to genetic testing. This is what I tell my patients. Knowledge really is power. And so understanding if you have a high-risk hereditary component or a high-risk gene that puts you at risk for cancer really allows you to empower yourself to then become more educated about your risk for cancer, also to employ some surveillance or even prophylactic surgery. There honestly really is no downside. So I tell my patients, for example, that there are congressional laws in place that protect patients from any genetic discrimination if there is a genetic mutation found. So you definitely cannot lose your health insurance. Also in the state of New Jersey, you cannot lose your life insurance as well, for example, if you have a genetic mutation. And by and large now, since the criteria for genetic testing has been so expanded, there really are not even any insurance barriers to testing. So to be honest, there really is no downside. I think, as I mentioned a few times, knowledge is really power. I really try to empower my own patients, as well as the different advocacy groups that I speak to and different educational events to, really know your family history, know if you're at risk for cancer, and then take action so that you can really help modify that risk. And really the fundamental way to do that is knowing your personal and family history and then undergoing genetic testing.
So what does genetic testing involve, and what can I expect during my doctor's visit?
So great question. There are a couple of ways to do genetic testing. One is to work with a genetic counselor who may take a very thorough family pedigree, who in your family has had cancers, what cancers, and then talk about if you meet the national criteria for testing. I like to do testing in my office. It's called point of care testing. A lot of us as oncologists or even as OBGYN or providers are doing testing in the office because unfortunately we see that there aren't as many genetic counselors in the country, and there is a big drop-off from the referrals to the physicians to a genetic counselor. So a lot of us are doing point of care testing. Really, it involves having a conversation with your doctor. Unfortunately, we see in the national literature that everyone thinks someone is talking to patients about their genes, whether it's someone like me who's a GYN oncologist, or whether it's the breast oncologist, who actually, they tend to be very good actually about taking a good personal and family history, or they think it's the internist or the OBGYN, and unfortunately at the end of the day, so many high-risk people are missed because physicians unfortunately are not speaking to patients about their genes, which is why on forums like this, we really try to educate listeners and participants to really know your personal and family history and talk to your doctors about that. If your doctor can counsel you and do testing in the office, that's wonderful. If not, he or she could refer you to a genetic counselor or to another, provider for the testing. There are people like me who do see women and men just for genetic counseling and testing. There are also a lot of great online resources, which we'll talk about towards the end, of this webinar, that you can see if you meet criteria for testing, and then we can help put you in touch with the right person to actually do the physical test.
Really interesting. So what about those of us who've had genetic testing in the past? Is there anything new in the field that we should know about?
Absolutely. So, I do see a lot of patients who say, I had BRCA testing or testing for one of the BRCA genes in the past and it was negative, which is really excellent. But we do know now, since really August of 2014, that a panel of tests have been available on the market. And a panel is actually looking at more genes beyond just BRCA1 and BRCA2 or the BRCA genes. And right now, if you've never had any genetic testing and we talk to you about your genes, we would actually send a full panel. Really, the best test on the market is, Myriad really is the industry leader for genetic testing. Their panel, for example, has 35 different genes that are associated with 8 different cancers. But all of the national guidelines really advocate that panel testing is the way to do genetic testing. So if you had BRCA testing in the past and you tested negative, you really should have an update test now, because we really want to look at those additional genes that we now know about to see if it puts you at high risk for breast cancer, ovarian cancer, things of that nature. I think I might have gotten a little bit ahead of myself. I also want to say, whether or not you have a personal history of cancer, it's really important to know, what your genetic status is, what your BRCA status is, what your genetic status is, if you meet criteria. Because even though you may have, say, a personal history of breast cancer, for example, if you have a high-risk gene that you've inherited from either mom or dad's side of the family, even though you might be cured from that cancer, we don't want you to get a secondary cancer or a second cancer because you may be at high risk. And so this is one of the things that I definitely love to talk to patients and also physicians about as well too, is that we certainly don't want anybody to get a second cancer because they're potentially at high risk from having a genetic mutation.
So when you talk about a family history, can you talk a little bit about what that means? What would we be asked?
Great question. So, because we see, unfortunately, that there's been a very slow uptake to talk to patients about genetic testing and actually doing the testing. Our national guidelines have put forth different criteria, and they've encouraged really all oncologists and physicians to at least take a minimal cancer family history. So we're looking at both mom and dad's side of the family. We want to assess at least with 2 generations, first and second degree relatives, who has had cancer, what cancers, and at what ages. And if you look at this big national organization that's called the NCCN, it's called the National Comprehensive Cancer Network, they actually put forth a lot of guidelines for oncologists and put forth guidelines for genetic evaluation. They actually say to look at 3 generations, so first, second, and third degree relatives on both mom and dad's side of the family. And it's important to find out who has had cancer, what cancers, and what ages. And now, as I mentioned in the beginning, the criteria really have expanded. So we do know that people potentially who did not meet criteria in the past may meet criteria now. That's why it's really important that you reevaluate this with your doctor, at least on an annual basis.
I have another question. I've seen these commercials on television for genetic testing at home, kits you can get in the mail. Why is it important to see my doctor for genetic testing? Can't I just do one of those?
Great question. So now there are a lot of different companies that are doing genetic testing, things that are being marketed directly to patients without even involving physicians. And I think we all have to be very careful and wary. So having a genetic test is not just like a routine blood test. For example, a CBC where we would check to see if we're anemic. And it's very important that the lab we use has high what's called sensitivity and specificity. We really need to be sure that if they tell you you're negative, that you truly are negative and you don't have a genetic mutation, or if they say that you're positive, that they've really found the right gene. So it's a very sensitive test, and it has a lot of implications, not only for you personally, but all of your family members as well too. So you really do want to use a lab that has a robust science, that has a robust way to validate the test and make sure that it's accurate. And so also, with some of these companies that you may be able to find on the internet, we really don't know the security of the data, like what are they really doing with your DNA, for example. And we really don't understand if they have a scientific process for validating their results. So for example, really the industry leader when it comes to genetic testing is Myriad Genetics. That's really the company that I solely use. They've tested the most patients in the country and have really a robust database as well as group of scientists that are constantly evaluating and reevaluating these genes. So, when you do have genetic testing done, your results can be either positive or negative, or when you're doing the panel testing that I mentioned before, you may actually have something that's called a variant of uncertain significance. And this is something where, as I like to explain to patients, we all have alterations in our genes. That's what makes all of us unique. And some of these alterations, though, we just don't know if it puts people at higher risk for cancer or not. So if you do have a variant, it's important that we treat you clinically based on your family history. But Myriad has a very robust database to reclassify these variants. The scientists are meeting on a daily basis, and as these variants get reclassified, patients and physicians are notified. Most of the time, these variants are actually downgraded to benign, but it's just important that that robust scientific rigor is happening, and you really want to be sure you're using a company that can accurately give you the information. It's a very sensitive test with a lot of important meaning.
Well, Dr. Lewin, thank you again for this conversation and for sharing this information, especially giving us the tools to have a good conversation with our doctors. Do you have any final thoughts to share?
I definitely do. I'd love to go over why identifying patients for testing now has become a lot easier. This is something that we really try to educate clinicians about. Our national guidelines say that really anyone who has information and feels comfortable with the genetic testing process can participate. So whether it's of course, a genetic counselor, but a physician, a nurse practitioner, a physician assistant. But if any of you listeners have a personal history of one of the following, please really do talk to your physicians about genetic testing. So really, if you have a personal history of breast cancer at any age, if you have a personal history of ovarian cancer at any age, metastatic prostate cancer at any age, now pancreatic cancer at any age, that's actually been a really new update, just happened at the end of 2019. If you've been affected by colon or endometrial cancer and you're under the age of 65, all of these criteria now meet criteria, I should say, for genetic testing. So if you have a personal history of one of the following, please really do speak to your doctor. Make sure you've had genetic testing, a panel genetic testing, and really the appropriate testing to date. You know, for those of you that may not have a personal history of cancer, but a family history of cancer, again, it's really become a lot easier to identify which patients now meet criteria for testing. So if you have a family history of any of the following, you know, please really do speak to your doctors about genetic testing. And again, you want to look at both mom and dad's side of the family, because a lot of times we think, or I hear patients think, oh, with the BRCA gene, it just affects women. And they really forget about their dad's side of the family. But men can also obviously have these mutations, and they certainly can carry these mutations onto their children. So just to give you an example before I go on to that criteria, about 1 in 300 to 1 in 400 men and women carry a mutation in one of the BRCA genes. So it's actually a pretty high frequency when you think about all the people in the population. The same thing is true for a syndrome called Lynch syndrome, which is just as common as having a BRCA mutation. Lynch syndrome, you see clusters in the family of having mostly colon cancer, uterine cancer, sometimes ovarian and gastric cancer, but there are families that can have breast cancer as well too. And this mutation frequency rate is just as prevalent. It's just that, unfortunately, we haven't had a star or someone come forward like Angelina Jolie to really bring a lot of light to this syndrome. When you're looking at an Ashkenazi Jewish population, which we definitely see a lot of course, in New Jersey and New York, about 1 in 40 of these men and women carry a mutation in one of the BRCA genes. So that's why it's really important that, you know, we see a lot of these high-risk men and women walking around all the time in front of us. And if we really open our eyes and take a good family and personal history, we'll find so many people that actually meet criteria for testing. For example, some of the new data shows that about 1 in 4 women who present to their OBGYN office, you know, just for their routine gynecologic evaluation, now meets criteria for testing. So these high-risk people are in front of us all the time. It's just really important that we know our family history, we know our personal history, and we really advocate for ourselves to speak to our clinicians, our physicians, about the role of genetic testing. So if you have a family history of any of these things, please really do speak to your doctors about genetic testing. So again, that's looking at first, second, and even third degree relatives on both mom and dad's side of the family. Breast cancer under the age of 50. So even if you have one family member who had breast cancer under the age of 50, that now meets criteria for testing. And that's actually a relatively new update. So people that might have that in their family who didn't meet criteria in the past certainly do now. If you see 2 breast cancers in one relative at any age, if you see 3 or more breast cancers in relatives on the same side of the family at any age, that definitely meets criteria for testing. If you have any family history of ovarian cancer, metastatic prostate or pancreatic cancer, or of course male breast cancer, that's definitely a big red flag because it's not very common. That definitely all meets criteria for testing. If you see colon or endometrial cancer in the family diagnosed under the age of 50, that could meet criteria for testing. We do know that men and women of Ashkenazi Jewish descent, because there is such a high frequency rate of having a BRCA mutation, really don't have to have a lot of criteria. So if you're of Ashkenazi Jewish descent and have a history of breast cancer in your family at any age, that meets criteria as well for testing. So, really these things are very important to talk about. Of course, if you have a mutation in the family, that also meets criteria for testing. But we do know that the criteria has really expanded so much that now really if you have any of these things based on your personal or family history, your testing is really warranted. And it's a really important opportunity to help prevent cancers. We do see, there are a lot of misconceptions that people think maybe genetic testing is just for those with advanced disease, but no, not at all. We actually need to identify and test people with early stage disease so that we can help prevent them from developing other cancers and certainly help their family members from developing cancer as well. The last thing I'd like to mention, if you don't mind, is that there are now a lot of targeted therapies for women who have, for example, a BRCA mutation and maybe have breast cancer or pancreatic cancer or ovarian cancer. So not only is that genetic information so important to prevent cancers and prevent secondary cancers and prevent families from getting cancers, but now we actually have treatment options for these men and women that have these cancers, ways that we can dramatically improve their outcomes. And so the genetic testing is just really so important for all those reasons.
That's great. Is there a way I can find that criteria for myself?
Absolutely. There is, if you want to find out if you're a candidate for genetic testing, there is a link. It's called mygenehistory.com. It's through Myriad Genetics. You basically input your information. It's all privacy protected, and it will tell you whether or not you meet the criteria for testing. So I know even though I listed off the general criteria, sometimes it's difficult to follow all of those things about your personal and family history. So if you do go to mygene.com, you can input your personal information and then it'll tell you if you meet the national criteria for testing. And then certainly please do speak to your doctors. Also, I know that Komen, even Myriad, we can put you in touch with resources in your communities if you need to find someone who can actually do the testing for you. In light of COVID now, we are seeing that a lot of genetic counseling and testing can be done remotely. So even if you are concerned about your family history or your personal history of cancer, you can even set up a telemedicine visit for this. So we can take your history and even have the kits mailed to your home. And there are different ways to navigate it in light of COVID, so we can safely obtain this life-saving information.
So the message is don't wait.
The message is definitely don't wait. And especially now too, we see so much data with COVID, how, since the pandemic began, so many screenings for cancer have really been put on hold. Just looking at the drop in mammograms and MRIs, for example, it's very upsetting because we certainly don't want to diagnose cancers at later stages. So I really employ and empower all of you, please, even though the pandemic has been very uncertain and life-changing for all of us, please really do keep up with your screening and your annual exams, and certainly, definitely talk to your doctors about your personal and family history for a genetic standpoint.
Thank you, Dr. Lewin. The Komen New Jersey website does have more information and links to resources for breast cancer patients and caregivers. That includes Komen's Breast Care Helpline, which is available Monday through Friday from 9 a.m. to 10 p.m., providing social support, coping strategies related to anxiety or concerns during these uncertain times, and links to resources such as places to get genetic testing. Calls to the helpline are answered by a trained and caring staff member and available in English or Spanish. You can call 1-877-GO-KOMEN or email at helpline@komen.org. We also have the Komen Treatment Assistance Program, which provides financial assistance for local patients dealing with the crippling costs associated with breast cancer treatment. To learn more about this program, visit KomenNewJersey.org, hover over the Community Impact dropdown, then click on the Treatment Assistance Fund. Thank you again for joining us today, and we look forward to providing you with more webinars in the future.